Hello students, in this video we'll be discussing about your periodontal tissue, the first periodontal tissue, that is your gingiva. As all of you know, the periodontal attachment or the periodontium which surrounds the tooth, right, which is supporting the tooth, can be divided into broadly four structures. First is your gingiva, second is your periodontal ligament, third is your cementum, and lastly you have alveolar bone. So these four tissues comprises of your periodontium, of which today we'll be discussing about gingiva, right? So if you have to define gingiva, the gingiva is defined as the part of the oral mucous membrane. As all of you know, oral mucous membrane is the soft tissue membrane that lines and covers all the oral structures, right? For example, let's say you have buccal mucosa, you have floor of the mouth, you have tongue, you have palate, and you have gingiva. Everything is covered by an oral mucous membrane, just like you have the skin covering of your tooth, of your body, right? Same way, this oral mucous membrane can be classified or divided into various types, mainly of three types. That is, you have keratinized mucosa, you have specialized mucosa, and you have lining mucosa, of which gingiva is that keratinized mucosa, or the keratinized part of the oral mucous membrane, or in other words, gingiva can be defined as the part of the oral mucosa that covers the alveolar process of the jaws and surrounds the neck of the teeth. There are three parts to this definition. It is a part of oral mucous membrane. It covers the alveolar process of the jaws, that is maxilla and mandible, and thirdly surrounds the neck of the teeth, right? So we will dissect this definition. That is, let's say you have mandible and maxilla. For example, I'm taking your mandible. Let's say if this is the mandible, and here you have the tooth. Here you have the tooth, like this. So this gingiva is a part of the oral mucous membrane. Oral mucous membrane can cover this entire jaw, entire mandible. But that part of the mandible which supports your teeth is referred to as alveolar bone, right? This portion is referred to as alveolar bone or alveolar process. So gingiva is that part of the mucosa which covers this, what I've shaded in red, this alveolar process of the maxilla or mandible, and also the neck of the teeth. Neck means near the cemento-enamel junction, right? If this is your tooth, if these are your teeth, then you have the gingiva which is surrounding the neck of the teeth like this, right? So that is basically your gingiva, right? Now, so if it has to be this thing I told you, it is a part of that keratinized mucosa. So gingiva is keratinized. Gingiva, firstly, it is keratinized. You should know, because it is constantly subjected to the occlusal or the masticatory forces. So it has to withstand them. So it should be keratinized or strong. All right. So this is the definition of your gingiva. Now, for your exam point of view, you can get many questions from this gingiva chapter. For example, you can have a long essay. You can get a long essay, right, wherein you have to write from A to Z of whatever we are covering. You know, the structure, the parts of the gingiva, the microscopical features, the macroscopical features, blood supply, everything. Gingiva itself can come as a long essay. Also, various topics from gingiva can come as short essays. They can come as short essays. Number one, what is most frequently asked in your university exam is your microscopical features. Microscopic features of gingiva. Also, the next short essay that will come for your exam is the cells of the gingiva. Cells of the gingiva, you have to write about both keratinocyte as well as non-keratinocyte. And lastly, they can also ask you about the clinical features, also referred to as macroscopic. Also referred to as macroscopic features of gingiva. And as a short question, you might get the blood supply. You might get the blood supply of the gingiva, right? To repeat, gingiva chapter can come itself as a long question, long essay, or the parts by part they can ask you, right? So it is very easy. If you learn it in one go, you know, any part they will ask you, you'll be able to write. So I started off with the definition that you should first understand what is the gingiva. Okay. Now, in layman's terms, the gingiva is referred to as gums. As gums. Coming to the next thing, your gingiva, macroscopically, it can be divided into three portions or three parts, right? Macroscopically means, or a broad sense, gingiva, based upon its location, it can be of three types. That is, you have the marginal gingiva, attached gingiva, and interdental gingiva. Marginal. Marginal means towards the margin, coronally, right? In this picture, if it is clear to you, this coronal most region of the gingiva, this portion is referred to as marginal gingiva, right? It forms a gingival margin. Whereas the second thing is attached gingiva. Attached gingiva, as the name suggests, it is attached to the underlying bone. I told you gingiva is covering the alveolar process of maxilla or mandible, and it is the attached portion of the gingiva which is holding the gingiva attached to this alveolar process. So this is attached to the bone. This is attached to the underlying bone, whereas marginal gingiva is not attached. That is why it is also referred to as free gingiva. It is not attached anywhere. It is freely movable. And the third region is your interdental region. Interdental, as the name suggests, interdental, between the teeth. So if you look at this diagram, where can you see the interdental region? It is this triangle shaped region which is present between the two teeth. This is called as interdental gingiva, also referred to as interdental papilla. Interdental gingiva or the interdental papilla, right? So if I have to draw it in a cross section, the same picture, if I have to replicate in a cross section, I will draw, this is a tooth and this is the gingiva like this. Underlying, you have the alveolar bone here. Again, this portion of the gingiva which is not attached is referred to as marginal or free gingiva, and that portion of the gingiva which is attached to the underlying bone through the periosteum. A bone has a periosteal outer covering, and that gingiva which is tightly attached to the underlying bone, and that portion which is attached to the underlying bone through the periosteum is called as attached gingiva, right? So you have one portion which is lying free and one portion which is attached to the underlying bone. All right. The third portion is between the two teeth, right? It's called as interdental papilla. Now, if you look at this diagram picture very closely, it is not only the three parts that are given. You have so many other labeling, right? Which is also important because this free and the marginal gingiva or the free gingiva is separated from the underlying attached gingiva by a line or a groove, which is referred to as free gingival groove. And this is the demarcation between the marginal and the attached gingiva. Whereas this attached gingiva, as you know, it continues as your vestibule, then extends into your buccal mucosa or the labial mucosa, right? So it continues as your alveolar mucosa like this. It continues as your alveolar mucosa, extending apically into the vestibule, right? So this demarcation between the attached gingiva and the alveolar mucosa is referred to as mucogingival junction. Is referred to as mucogingival junction. We have three tissues: free gingiva, attached, and the alveolar mucosa. Between free and the attached, it is free gingival groove, whereas between the attached and the alveolar mucosa, it is mucogingival junction. And this mucogingival junction, its position is fixed or stable throughout life. Its position is stable throughout life. Okay, so this is broadly, macroscopically, the anatomy of your gingiva.